test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear part of a presentation about a recent report on podiatry education. You now have 90 seconds to read questions 31 to 36. This is a Benchmark Education Solutions sample test paper.
Hello everyone. Thank you very much for attending this session on podiatry education to empower patients to self-care. The reason that this research was undertaken was due to the many surveys that have reported a high number of people suffering from foot problems. For example, one survey showed that 95% of people over the age of 75 reported having problems cutting their toenails. Another survey found that 29% of people over the age of 65 reported experiencing problems with thick nails and/or skin problems. Many of the conditions that patients present with, such as those just mentioned, could be safely and appropriately handled by the patients themselves if they had the confidence, skills and knowledge to do so. Some of these and other foot problems have previously required NHS podiatry services, so empowering patients or their carers to deal with their own minor foot problems like nail care can reduce the burden on NHS podiatry services and in turn save money. This would also allow NHS podiatry services to concentrate more care on those with the greatest need and highest risks, such as people with diabetic foot problems. With that in mind, this project was designed to identify and train patients suitable for self-care so that they can be discharged from the service. Patients suitable for self-care include those who do not have any high-risk medical or podiatric needs, as well as those who are fit and able to provide their own foot care or who have a family member or care able to provide it for them. For this project, a system was designed to triage patients as high or low risk as they enter what we call the empowerment pathway. Patients considered to be high risk had one or more of the following: a history of non-traumatic amputation, foot infection or foot ulcer, were on oral steroid therapy, or had an infected ingrowing toenail, among others. Examples of conditions considered to be low risk were painful callus or corns, or thickened and deformed nails. Patients assessed as low risk or able to provide their own foot care safely were discharged to self-care with advice as well as follow-up awareness sessions. Awareness sessions were provided in local health centres and up to 10 patients were invited to each. In addition, invited patients were encouraged to bring a family member, carer or spouse with them if they felt they were unable to carry out daily living activities for themselves. The sessions covered the role of podiatrists, the type of conditions that are treated by the NHS Podiatry Service, and the types of common foot problems that can be self-managed. Training was also provided to patients on safe nail filing, and leaflets were provided to reinforce the information. If at this time patients revealed they had a more serious foot problem or medical condition, they were offered an assessment by the podiatrist. After the initial phase of the project, which included the triaging system and awareness sessions just described, the first impact was noted in the first group of patients assessed. The benefit for the NHS was a saving of over £138,000 for a population of 560,000. This savings resulted from enabling some patients to be discharged from the podiatry service to self-care. If we look at it on an individual level, for every patient who can self-care, NHS saves about £55 per year, which is the cost of a 40-minute assessment appointment conducted by a qualified podiatrist. This project also helped to reduce the caseload of podiatrists, who prior to the project had an average more patients than comparable services like physiotherapy and psychology. The benefit to patients with serious foot conditions was also quite dramatic, as before the project began, there was a waiting list of approximately 3 years due to the lack of spare capacity and very few people being discharged from the caseload. Once this initiative was fully implemented, all high-risk referrals were seen within 4 weeks, and all low-risk referrals were seen in 12 weeks. And finally, for the patients involved in the project, patient satisfaction has been improved because all patients were assessed by a podiatrist and given one-to-one foot care advice. We have worked closely with patients, including conducting surveys and one-to-one interviews, to examine how patients feel about the empowerment pathway. As a result, we are working to make some changes to this initiative, which include:
Now look at Extract 2. Extract 2, questions 37 to 42. You hear an interview with a nurse about common problems in hospitals. You now have 90 seconds to read questions 37 to 42.
Hello everyone, I want to welcome you all today to this interview with the leader of the Australian Nursing Federation. Sally began her career in nursing in aged care. and she also has a background in oncology and emergency nursing, having held a variety of roles. Her areas of interest are standards and practice, leadership and patient safety. So, Sally, tell us about what originally attracted you to the field of nursing.
I always knew I wanted to do something in healthcare, but I think what drew me to nursing was the fact that nurses are uniquely positioned as advocates for patients. I liked the idea of working for and with patients to help in the planning and delivery of health services.
That's an interesting take on things. So now in your role as president of the Australian Nursing Federation, you work to promote and protect the profession.
Yes, that's what we do. I mean, it isn't just me. I work with a strong and experienced team to improve the interests of nurses and midwives in the country.
So you are here today to talk about some of the challenges that nurses face in the hospital setting. So what, in your opinion, is one of the biggest challenges facing nurses in this setting?
Well, it is hard to say which is the biggest challenge, but one that we have been hearing more about lately is the desire for physician integration in care teams. We have more and more locum physicians, which is good for the physicians because they get the flexibility in terms of time and location. But this means that there is less of a chance for physicians to integrate with the rest of the team. It also means that we, the nurses, are doing double duty because these physicians don't communicate with the rest of the team very well. I mean, I think healthcare systems are realising more and more that an integrated care model is the best for patients. Having physicians coming and going is not compatible with this trend.
That's interesting. I would have expected you to start with staffing shortages, which is a problem plaguing all areas of healthcare. I mean, general physicians have been trying to raise awareness for several years about the dramatic rise in their caseloads.
Well, yes, short staffing is definitely a challenge for nurses in any setting, but particularly hospitals. And this affects the profession in a number of ways. For example, nurses may not feel like they are doing enough, causing dissatisfaction and burnout. It can certainly be emotionally and physically draining when repeatedly you can't provide the care you think is necessary. This can lead to significant turnover in many healthcare organisations and settings. Also, most concerning is the fact that staffing issues are a hindrance to patient safety. Recent research shows that nursing shortages result in errors as well as higher morbidity and mortality rates.
And I would imagine that staffing shortages would lead to longer working hours. Is that true?
Yes, that is true. Nurses often work extended hours and overtime, which puts them at risk for making mistakes. A recent survey showed that 47% of nurses reported working regular overtime.
What is your organisation's policy on this? Do you think that regular overtime is acceptable?
We know that nurses should not work more than 40 hours a week, and we believe they should work no more than 12 hours in a day, ideally less, because you reach a point where you start to have cognitive decline. It also creates situations where nurses start to treat each other poorly.
What are some challenges that nurses face that people might not be aware of?
I would have to say workplace violence and bullying and harassment. A report that came out last year from the Government Accountability Office found that healthcare workers in inpatient facilities such as hospitals experienced high rates of non-fatal injuries such as hitting, kicking and beating. Nurses also regularly experience bullying and harassment. The report I just mentioned found that 71% of nurses said that they had been harassed by a patient, which is far lower than the percentage reported by physicians.
That is the end of Part C. You now have 2 minutes to check your answers.